Coming up next on the Holistic Wealth Podcast.
The number one that I see in my office, the number one form, I should say, is osteoarthritis. That's just plainly cartilage breakdown. That's something we get as we get older, no matter what we do. Then there's also rheumatoid arthritis. That's the one where our body is autoimmune, everyone. So it's like our body is kind of fighting our joints at that time. So we have to be careful with that. And usually you're followed by a rheumatologist for that.
You're listening to the Holistic Wealth Podcast with host Keisha Blair, author of Holistic Wealth and founder of the Institute on Holistic Wealth. And now, here's your host, Keisha Blair.
Welcome to the Holistic Wealth Podcast, and I'm your host, Keisha Blair, and today we have another special episode of the podcast for you. And in this episode, we have our special guest, Dr. Ken Redcross, and we'll be discussing arthritis pain management in this episode. Now, Dr. Redcross is the author of Bond, the 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor, and founder of a unique concierge service providing patient-first treatment through strategic health services. As one of the first full-service concierge personalized medical practices in the United States, Dr. Redcross's patient portfolio includes executives, athletes, entertainers, as well as individuals from all walks and stages of life. Dr. Redcross frequently shares his expertise in managing everyday health challenges, embracing both natural and alternative methods of healing. He has authored numerous health articles for MSN Latino and Everyday Health. Dr. Redcross earned his MD from Columbia Presbyterian Medical Center in New York, specializing in internal medicine. Dr. Redcross, it's so great to have you on the Holistic Wealth Podcast again. Thank you so much for being here.
Hey, Keisha, how are you? Thank you so much for having me back on my favorite show, Holistic Wealth Podcast. And I hope to hopefully touch some lives today as well as we talk about the importance of pain management and arthritis or joint challenges. So thanks again.
Awesome. Now, many of our listeners suffer from arthritis. I'm an arthritis sufferer myself, and so many people find it harder to walk, move around, and enjoy physical activities. I know when your joints wear down over time, the cushioning provided by the cartilage erodes, resulting in pain and stiffness, and managing the pain can actually be a challenge for so many people on a day-to-day basis. It's actually estimated that 1 in 4 individuals, or about 58.5 million people, have been diagnosed with arthritis and suffer from arthritis-related joint pain. And as I said, pain management can be a real challenge for people on a day-to-day basis with arthritis. So let's start from the basics of arthritis. What is arthritis and what are the most common types of arthritis?
There are many different types of arthritis, and it kind of isn't a one-size-fits-all. When you look at the research, the Arthritis Foundation says that 60 million adults are diagnosed with arthritis each and every year. There's 100 different types of diseases and conditions that I see in my office that are all related to arthritis. So the most common one that we talk about, a lot of my patients, especially down in the South, will say, Arthur is bothering me today, won't leave me alone. And it took me a while to understand what they were talking about, but they were talking about arthritis. And the number one that I see in my office, the number one form, I should say, is osteoarthritis. That's just plainly cartilage breakdown. That's something we get as we get older, no matter what we do. Then there's also rheumatoid arthritis. That's the one where our body is autoimmune, everyone. So it's like our body is kind of fighting our joints at that time. So we have to be careful with that. And usually you're followed by a rheumatologist for that. There's also gout. Gout used to be the rich man's disease, or I guess I should say rich women's disease, a long time ago with the kings and so forth. And that's when crystals of uric acid kind of get deposited within the joints. Very, very painful, but pretty common. And then there's also psoriasis, which is a condition that can cause arthritis. And also children can get juvenile arthritis. So as you can see here, Keisha, there are a lot of different ways that we can have challenges with our joints, but it's important that we're talking about that today on the Holistic Wealth Podcast.
So I know that, people, especially, our listeners are thinking, well, what are the symptoms? People have pain. A lot of people suffer from chronic pain on a day-to-day basis. They may be listening in wondering, is it arthritis? Dr. Redcross, can you tell us what are the symptoms that people should look out? What are the symptoms of arthritis?
So what are the symptoms of arthritis? Well, I mean, they typically are some of the common ones. The stiffness, the pain, swelling. Most of my patients that are dealing with arthritis will talk about a little bit of a lack of their range of motion. Some of these other sort of arthritis that I mentioned before, like gout, tends to be associated with warmth in the joint. That's also not a good thing. So it's just important that we understand the cause of the joint pain, because as I mentioned before, there's different things that can actually be the issue that are causing the biggest problems.
Great information shared there. And if we're looking at risk factors, I know some people are thinking, well, am I at risk? Is it just a disease of, a particular age group?
So the question I get quite often, Keisha, is who's at risk for arthritis? I mean, I can tell you, it's people of all ages or sexes or race. Everyone in those groups or in these groups can be at risk for arthritis, to be honest. Sometimes arthritis can run in families. It can affect women more than men. Obesity tends to be a big risk factor for arthritis. It can make sense, right? You have a little more weight than you should have, and imagine that kind of weighing on your bones all day, really leading to the wear and tear. There is a higher incidence in women, though. I find it kind of fascinating. It's about 29%, almost 30% in women and about 23% in men. It can definitely change depending on some of these other things, like I mentioned, obesity. It tends to be the largest in the groups, around 45 to 65. So that is when I start hearing a lot more complaints. Also, a little bit higher in African Americans, and then Hispanics, and then non-Hispanic Caucasians next. And that kind of goes with some of the medical challenges that we have in the brown and black community, right, everyone? Making sure that we're eating the right foods, making sure that we're watching our weight and that sort of thing. So look, all of these are not necessarily just the perfect numbers. It's just giving us an indication on the groups that I kind of need to also kind of focus on a bit, just to make sure that I'm doing my best to help them avoid arthritis.
Now, I know some people listening in are wondering, well, how do I get a diagnosis? Dr. Redcross, how is arthritis normally diagnosed?
Well, number one, this gets back to the importance of the patient-doctor bond for me. I mean, look, I need to do a good detailed family history. I need to get some kind of lifestyle habits, like what sort of things are you eating? What are you doing for your exercise? And then obviously a physical exam when I can see limited range of motion for myself, or I can even hear crepitus, it's called. I can hear the joints kind of creaking a bit as well. Obviously, if it becomes a bigger issue, you'll see your doctor, you'll get an x-ray, which will show some destruction of the joint, or MRI. If we're looking for some of the other different types of arthritis or arthritis, as I mentioned before, to look for inflammation or erosions and that sort of things. Sometimes nerve testing comes on, but not necessarily everyone for the bony pain per se. It's just to sort of rule out neuropathic or neuropathy and that sort of thing.
Now, earlier in the episode, I spoke about some of the warning signs. We listed some symptoms, but Dr. Redcross, if people are, listening in and they're wondering about warning signs, can you explain some of the warning signs of arthritis?
So yeah, what are the warning signs of arthritis? Well, it's that pain. It's pain that usually when it's resting, when you're at rest, I should say. You can get it when you're going up steps and so forth, meaning the pain. But typically patients will say, even while I'm at rest, it just feels like my joints don't feel well. I feel stiff when I get up, especially in the morning. That's a clue, everyone, typically for potential for rheumatoid arthritis. Not all the time, but those are some of the signs that I listen out for when I'm talking to patients in the office or on the telephone. So, think about it when you're sitting in a desk or riding in a car for a long time. Are you really having some stiffness and pain? Those are the signs you want to make sure you reach out to discuss with your doctor.
Now, people might be listening in and wondering, what type of doctors treat this? Should I just go to my GP? Is my GP okay to diagnose me, or do I need a specialist? So, Dr. Redcross, what type of doctors normally treat arthritis?
Well, it gets back to the type of challenges we're having. As I mentioned before, the most common arthritis that I see in the office is osteoarthritis. That's that wear and tear that we see. So that can just be a primary care physician like myself, who's an internist, internal medicine physician. But look, should it become a little worse, or you feel like there's definite limitations in your movement, if you feel like there's a little bit of swelling at the joint as well, that's when I have to pick up the phone and you talk to your orthopedic surgeon. Don't worry about the name. I don't want to scare everyone to say, hold on, doc, do I need surgery right away? The answer is no. But the orthopedist is a specialist of the joints, and they'll be able to do some imaging and just do a little bit of a deeper dive just to make sure that there isn't too much destruction that then may require them to fix or replace. So just don't be afraid, but that's the first doctor. The second doctor, I should say actually the third besides the internal medicine and primary care team, are the rheumatologists. They're for those autoimmune conditions. In particular, we're talking about rheumatoid arthritis that I mentioned before, and even potentially gout. It just kind of depends on where you fall in between that. But between the three of us, meaning the rheumatologist, the orthopedist, and your internist or family doc, we should all be able to manage your joints quite well, but that's where you start.
Now, we mentioned the pain management earlier and the challenges that people face in terms of pain management. What are some of the closer to the earth remedies that you prefer to give your patients and even your own family in terms of arthritis pain management?
You know, I always love talking about these particular closer to the earth remedies for a reason. Look, prescription pain relievers can definitely be effective, but they can also come with a lot of other challenges that I don't want to worry about for the patient or even for myself for them, such as sometimes some of the pain relievers need to be monitored. You need to monitor the liver health. You need to monitor the kidney health. See, this is perfectly where homeopathy comes in. The reason why I say the closer to the earth with homeopathy is because I can rely on some things with homeopathy knowing, number one, I'm not going to have to worry about drug-to-drug interactions. I'm not going to have to worry about potential side effects. I'm also going to be able to say that there are some things that have definitely been shown to be very, very beneficial for your joint health. One of the places I typically start is with Arthritis Arthritis Cream. Now, why do I start here? Well, because it actually has two pain relievers, but it's all in one particular formula. So I don't have a patient taking one or two things. I'm actually using the Arthritis Arthritis Cream because it has two important formulations in there. One is called Devil's Claw. It's arnica, and the Devil's Claw is actually a hypercophytum. Try saying that 20 times, right? But the point is so hypercophytum is easier to call it Devil's Claw, but it's that with arnica in the formula. And the importance there is that it's been shown to reduce minor soreness and stiffness, and also joint pain is associated with arthritis. Also love the fact that it's topical because it's quickly absorbed into the skin to take away pain right where we are applying it. See, some of the other gels can, once again, just cause different problems, local site reactions, we call them, such as irritation or a rash or stinging. And I don't have to worry about that with the Arthritis Arthritis Cream. So that's good. I also like the fact that it doesn't have a fragrance. We all know some of those creams that we remember from our grandparents that you could smell a mile away with that strong medicinal menthol sort of smell. But you don't have that with the Arthritis Arthritis Cream. So I like that. I also like the fact that it's dye-free. I don't like those things that are kind of added to the patient's regimen. It's not really doing anything but causing problems in the future. It's also good because I'll have some young athletes. And so if the child is 12 years and up, so 12 years and us adults can be more than fine with the Arthritis Arthritis Cream. So that's a good thing. I also like that Arthritis Arthritis tablets are out there. I typically use this sort of thing for people who need some relief of joint pain and stiffness, but they're kind of out and about a bit, and it's a little bit harder sometimes to carry a tube of cream or what have you for them. You know, I also like the fact that unlike some of the other pain relievers, that the homeopathic remedy, this particular Arthritis Arthritis tablets, it helps some of the joint pain that's associated with damp weather or heat, motion. And we all know how people will say, you know, when it rains, my joints feel a little bit worse at that time. So I kind of like bringing them together. When you're thinking about the tablets, Keisha, it's actually safe for those 18 of your age and older. It's a melt-away tablet, so you don't need water. And there's no, artificial flavors. So, these are the things that I like to try first, everyone, before I have to pick up my prescription pad and see what I need to do from there. So, I find it very valuable to have other things that can make such a difference in the lives of my patient.
And when we talk about lifestyle factors like diet, exercise, lifestyle modification, how can changing your diet help manage arthritis symptoms?
So the thing I always love to talk about is we talk about things that we can utilize to make our lives better. Look, how can you change your diet to help manage arthritis symptoms? Think about that. We have the power to kind of change things in our diet to make a big difference. Let me first preface it. Number one, smoking is a super no-no. Smoking causes whole body inflammation, which we don't want in our entire body, our heart, our lungs, but especially our joints because of the inflammation. The other thing I want you to do is think about what you have in your cupboard that can make a huge difference, such as omega-3 fatty acids. That's why I love salmon and tuna. We have to be careful with the mercury, but that's when you're taking fish too much all day, every day, which everyone doesn't do, but we should get more fish in our diet. I also love vitamin B6, polyphenols. I also love colorful fruits, vegetables, nuts, and seeds, and whole grains. As you see, I'm talking about a lot of things that are already on the Mediterranean diet, everyone. So if you want to learn how you can do some things to help your joint health, think about the Mediterranean diet in particular. I also love turmeric as well, which is another natural way to help support your joints. The other thing is, don't overdo it, everyone. This isn't a food we're talking about here, but I just don't want you to overdo it because you just need to know what your limitations are. Sleep is also a big part. Sleep is huge because sleep is an important time for rest, recovery, and regeneration for our bodies. And that's really inflammation, which we also want to keep at bay. And as I mentioned, when you're thinking of things that are closer to the earth, the first place to start is usually with homeopathy.
Absolutely, yes. Great advice there. And so most arthritis symptoms don't require a visit to the doctor. However, when should you see a doctor?
Now, you see your doctor if you realize that after the first 2 to 3 days or so that, hey, doc, I'm not getting better. Things are getting worse. My joints are swelling a little more. I'm not feeling myself. You pick up the phone and hopefully, God willing, you have a good relationship with your doctor so that you're not waiting to get in to see him or her. Because once again, your doctor should feel like a member of your family. And when you think of joint health, that's something that really requires a good relationship with your doctor because these sort of aches and pains come and go. And that's why it's a good space for a homeopathy to kind of be there while you kind of wait to get to your doctor, if need be, if you're not improved like so many of my patients by just going with the Arnicare arthritis cream or the tablet. So in any case, everyone, look, I hope this has been helpful and you realize that you have the power. You have the power to take care of Arthur or your arthritis when these things sort of come up. And you could do it naturally and you could do it with some things that are closer to the earth. But the important thing is that you're educated about arthritis, the types of arthritis, and what you can do to make your life experience even better. So anyway, I hope all of this was helpful. And Keisha, once again, thank you so much for having me here on the Holistic Wealth Podcast. I absolutely love being a part of your network. So please, everyone, I hope you are well. And I really mean it. Feel free to reach out. Send me a message. Send me a note. Follow me. Whichever, Dr. Ken Redcross, MD. I always love meeting new people.
Thanks again, Dr. Redcross, for sharing those nuggets of wisdom and insights with our listeners. As usual, we're so grateful to have you here to share this advice with us on the Holistic Wealth Podcast. And for everyone listening in, you can connect with Dr. Redcross on his social media, on his website. His Instagram and Facebook handles are at Ken Redcross MD. On TikTok, he is at Dr. Ken Redcross, and you can find him on his website. Again, thank you for joining us this week on the Holistic Wealth Podcast, everyone. And please do share this episode with your entire network. If you know of people who are chronic pain sufferers or arthritis sufferers, please do reach out and share this episode with them. Also ask them to share it with their networks. And please leave us a quick review on Apple Podcasts or on Spotify or whatever platform you listen to this podcast on. Reviews do help others to find the podcast and get access to this great information that we're sharing. So reviews are actually so critical. Thank you so much for joining us this week on the Holistic Wealth Podcast. We hope you have a great week ahead, everyone. Have a holistically wealthy week. Thank you guys for joining us.
The Holistic Wealth Podcast with Keisha Blair is brought to you by.
Have you joined the Institute on Holistic Wealth? If you haven't already, what are you waiting for? Choose your membership plan at the Institute on Holistic Wealth/memberships to join. As a member, you'll get access to free worksheets, advice, coaching, and an intentional design workshop. As you start to live a more holistically wealthy lifestyle, you'll want to stay for a very long time. So go to Institute on Holistic Wealth/memberships to join. If you haven't read the book yet, pick up a copy of the award-winning best-selling Holistic Wealth 36 Life Lessons to help you recover from disruption, find your life purpose, and achieve financial freedom.